looking at a cross section of the breast, there are structures that are called Cooper's ligaments, and that's what holds the breast in its normal shape. And that's what makes the difference between a beautiful breast and a ptotic older breast. Basically, there's 18 ligaments of 18 Cooper's ligaments, and with age and gravity, the Cooper's ligaments get lengthened and lose their elasticity. There's 3 muscles that are directly related to the breast. The bigger one is the pectoralis major, the serratus anterior, which is the colored one now, and the external oblique. This shows an extensive array of the blood supply, and it's very important to know the anatomy of the blood supply so that when the surgeon is doing the surgery, there's no compromise to the nipple-areolar complex, which is basically the most important structure that is affected by the surgery. The IMA, or internal mammary artery, supplies 60% of the breast, and as you see here, the lateral thoracic supplies 30% from the other side, and intercostals give the other 10%. Innervation, same thing. That's why when people do surgery on the breast, depending on the procedure, there is a 10 to 40% chance of nipple sensation loss, and depending on if you're doing just breast augmentation or if you're doing a lift, there's a higher effect on the nerve supply. And this shows the different nerves that supply. You can see there's an extensive array from the middle of the chest and from the lateral side of the chest. As I was speaking before, the breast shapes changes with time, with age and gravity. There are 2 constants in life: age and gravity. And as you see here, as the body matures and grows, the breasts become more ptotic and lose the volume superiority. So when the surgery that we do, we try to do 2 things. We're counteracting gravity by lifting the breast and giving it more volume, which is lost with time. So there's, what is a beautiful breast? A lot of people try to get measurements to determine what's the best way to get a measurements for the normal breast, because you will see no 2 breasts alike. It's like a fingerprint. Everybody's different. So the normal distance from between the nipples is 21 centimeters. Distance between the clavicle coming down to the nipple-areolar complex is also 21 centimeters. So there's different measurements that we can do to determine the normal shape of the breast. And this way we'll know how much we need to lift the breast. This is a side view showing the 21 centimeters from the clavicle down to the nipple-areolar complex, and then the important part would be the skin at the bottom part of the nipple-areolar complex to the chest wall, and that's the amount of skin that we have to take if we're doing the lift to bring up the nipple-areolar complex.